A study by Andreas Eklund, published in the European Journal of Pain, looked at how expectations influence treatment outcomes in those with low back pain. The study included 593 participants. On the first visit, the participants were asked, how likely do you think it is that your low back pain will get considerably better? And then they rated that on a scale from 0 to 10. And then on the fourth visit, they were asked a subjective question, which was, is your low back pain better? And that was rated on a scale from 0 to 5, 5 being definitely better, 0 being worse. And what this study found is that for those who had a high expectation of relief, that they had a greater response to treatment. And the data breaks down to about 74% of those with high expectations had pain relief versus 47% for those who had a low expectation of relief with treatment. This study also found that this association was not modified by psychological profile, pain intensity, or self-reported health. And so the results that they found were due to the expectation of pain relief versus anything else that they had measured in the study. The results of this study highlights a couple of different aspects. One of those aspects is evidence-based medicine. Evidence-based medicine is comprised of 3 different pillars. We have what the evidence says, clinical experience, and also patient beliefs. And obviously when we think about evidence-based medicine, we think about what the evidence says. But we need to make sure that we're accounting for both clinical experience and patient beliefs. And this article in particular highlights the importance of patient beliefs. If they have an expectation that a treatment is going to be beneficial for them, they have a higher likelihood of having a positive outcome, and that's obviously of benefit for the patient. And there's obviously limits to how far this actually should go. We need to make sure that the treatment approach is actually safe for the patient, but we need to make sure that we're taking into account both the evidence and clinical experience, as well as patient beliefs, and setting the patient up for the highest likelihood of success. And the results of this study also make me think about healthcare as a whole and how these psychological factors can have an impact on our outcomes. For example, how was the experience for a patient making an appointment? Were they able to get in immediately to go see their doctor, or did they have to wait several weeks? When they actually arrived at the clinic, were they greeted promptly and they felt welcomed and there was a positive, happy atmosphere? Or did they not experience that? Did they have to wait for a long period of time because the doctor was running behind in their schedule? When they actually met the doctor, how was that interaction? Did they feel like they were being heard and understood when they were kind of going through their history and what they're dealing with? All of these things can play a role in our outcomes. And so as healthcare providers, I think we need to be aware that not only from a treatment aspect, but also just an experience as a whole, that can have a role in our outcomes.